Hello friend, today we will discuss about what are the basic of pharmacology. In brief, it is in handwritten. So let us start our video. Basic of pharmacology. Pharmaco means drug, logy means study. Study of drug is known as pharmacology. Now see what is drug. Drug is a substance which is used to prevent, cure and control the disease. Now let us see what are the types of pharmacology. Pharmacology are of two types, pharmacodynamic and pharmacokinetic. Pharmacodynamic is the study of action and mechanism of the action of drug. It's the study of action and mechanism of action of drug. That is pharmacodynamic, what drug does to the body. Okay. Now let us see what is pharmacokinetic. Pharmacokinetic deal with absorption, distribution, metabolism and excretion of the drug. That is what body does to the drug is called as pharmacokinetic, and what drug does to the body is called as pharmacodynamic. Now let us start with pharmacodynamic. Pharmacodynamic is the study of effect of drug and the mechanism of their action is called as pharmacodynamic. Here are some terminology we should understand, that is what is receptor. Receptor are the specialized molecule present on the surface of the cell, are also present inside the cell, which bind to the drug and help to show their effect. Simple. And now understand what is affinity. Affinity is the ability of a drug to bind a receptor. Okay. What is intrinsic activity? Ability of a drug to produce an effect after binding to a receptor. Now let us understand what is agonist. Agonist means increased activity. When drug bind to a receptor to produce an effect, it's called as agonist. जैसे यहाँ पे ये सेल का रिसेप्टर है, यहाँ पे ड्रग बाइंड किया और ये एफिनिटी, ड्रग बाइंड कर लिया तो एफिनिटी और इफेक्ट शोज कर रहा है, मतलब एक्टिविटी को इंक्रीज कर रहा है, तो वो एगोनिस्ट हो गया. Now let us understand what is antagonist. It is just opposite of it. That is inhibit the activity. When drug bind to a receptor but do not produce any effect. Here you can see that affinity is there, but there is no intrinsic activity. Like when drug bind to the receptor of the cell, it shows no effect, but affinity is there. That is called as antagonist. Okay. Now let us see what is potency. Potency is the measurement of the drug, which is how much required to give a response. Okay, suppose that if any patient is suffering from fever, he has 104-degree fever, and drug A of 15 mg reduces to 97 degree, whereas drug B of 5 mg reduces the same fever to same extent. The response is same, but the quantity differ. That is the reason drug B is more potent. Lower the dose, higher is the potency of a drug. Here in potency, here it is weight to weight comparison. Okay. Now see efficacy. Efficacy is the drug capacity to produce its maximum response. Suppose same fever is there 104 degree and drug X reduces to 100 degree. That is, it is maximum response of drug X. Whereas drug Y reduces 104 degree to 97 degree. That is its maximum response, drug Y. Therefore, the efficacy of drug Y is more. Okay. Now let us see what is therapeutic window. The range between minimum effective dose and maximum tolerated dose to determine the safety of the drug is called as therapeutic window. Larger the therapeutic window, safer is the drug. Here is two terms, that is minimum effective dose and maximum effective dose. Minimum effective dose, the dose of the drug from where the response effect या begin करता शुरू करता है, वो minimum effective dose हो गया. Maximum tolerated dose, कि मतलब कि the dose up to which drug can be used safely. Okay, the difference between minimum effective dose and maximum effective dose is called a therapeutic window. So important point is, larger the therapeutic window, safer is the drug. Okay, now let us see what is pharmacokinetic. Pharmacokinetic deal with ADME process, that is absorption, distribution, metabolism and excretion, that is elimination. Okay, so let us see what is absorption. The transfer of the drug from its site of administration to the blood stream. मतलब ब्लड स्ट्रीम में जाके ड्रग कैसे मिलता है, उसको एब्जॉर्प्शन कैसे होता है, वही इसमें एब्जॉर्प्शन प्रोसेस आएगा. इसमें इंपॉर्टेंट टर्म है कि बायोअवेलेबिलिटी क्या होती है, फर्स्ट पास मेटाबॉलिज्म क्या होता है. फर्स्ट पास मेटाबॉलिज्म वो होता है व्हेन ड्रग फर्स्ट टाइम पास थ्रू द लीवर एंड मोस्टली एब्जॉर्ब. पहली बार जब पास होता है लीवर के थ्रू मेटाबोलाइज होने के लिए, और जितना एब्जॉर्ब होता है वही उसकी बायोअवेलेबिलिटी होती है, क्योंकि वही ब्लड में जाएगा. तो बायोअवेलेबिलिटी क्या होती है, द परसेंटेज अमाउंट ऑफ द ड्रग रीचेज इन सिस्टमैटिक सर्कुलेशन, इट्स कॉल्ड एज बायोअवेलेबिलिटी. ओके, नाउ अंडरस्टैंड व्हाट इज डिस्ट्रीब्यूशन. Once drug comes in the systematic circulation, it gets distributed to various tissue like heart, muscle, skin, kidney. Okay, all over the body. अब देखते हैं व्हाट इज प्लाज्मा प्रोटीन बाइंडिंग कैपेसिटी. हियर वी हैव टू अंडरस्टैंड द डिग्री टू विच ड्रग अटैच टू प्रोटीन. अब ड्रग अंदर चला गया ब्लड सर्कुलेशन में, वहां से टिश्यू के पास पहुंच गया, तो अब जो डिग्री है मतलब उसका कितना ड्रग प्रोटीन से कितनी तेजी से अटैच कर रहा है विद इन द ब्लड. ए हाई डिग्री ऑफ प्रोटीन बाइंडिंग सर्व एज ए ड्रग डिपो which helps in extending the duration of action of drug. Okay, I hope you will understand it. What is plasma protein binding capacity? Now let us see what is blood-brain barrier. Blood-brain barrier is a semi-permeable membrane which is only lipid soluble can cross it. Water-soluble drug cannot enter. Therefore, blood-brain barrier protect brain from foreign substances and harmful effect of the drug. Okay, now understand what is metabolism. Metabolism is the process of the chemical chain that act on all substances entering the body, including drug. Basic aim of the metabolism is to make the lipid soluble drug into water soluble drug so that it can be easily eliminated. Okay, now understand what is elimination. Elimination is the process by which the body throw out the drug. Okay, by renal means by fecal, by pulmonary that is lung, by sweat gland, by breast milk out of the body. कैसे जाता है, elimination process उसमें आएगा. Now understand very important concept of area under curve. Suppose CMAX. What is CMAX? That is the peak plasma concentration. कोई भी ड्रग गया आपके बॉडी में गया, बायोअवेलेबिलिटी सबसे ज्यादा वो यही होती है, बायोअवेलेबिलिटी यहाँ तक आएगा, वो हो गया CMAX. कितना एब्जॉर्ब हुआ, तो इसका कितना कॉन्सेंट्रेशन अब्जॉर्ब हुआ CMAX के ऊपर तक आएगा, ये टॉप है. ठीक है, अब ये TMAX क्या होता है कि टाइम टेकन टू रीच CMAX. यहाँ तक का जो समय लग रहा है, ये यहाँ पे समय लग रहा है 2 घंटे का, यहाँ तक 225 mg पहुंचने में, वो होता है TMAX, टाइम टेकन टू रीच CMAX एक्सप्रेस्ड इन RR मिनट. और इसका T हाफ क्या होता है, प्लाज्मा हाफ लाइफ, मतलब टाइम टेकन फॉर द ड्रग टू 50% ऑफ प्लाज्मा कंसेंट, मतलब यहाँ से ड्रग कब आधा हो गया, कब तक आधा हुआ, उतना का T हाफ उसको बोलते हैं प्लाज्मा हाफ लाइफ. T हाफ से डिसाइड होता है डोज फ्रीक्वेंसी, कि पेशेंट को OD दी जाएगी, BID दी जाएगी, TID. OD means once a day, BID means twice a day, और TID means thrice a day. Okay, I hope you will understand it very well. Thank you.